From the News Channel 5 Network, this is MorningLine with Nick Beres.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here with you on a Thursday. Good show on tap for you. So many of you, I think, over the years have tuned into this program, especially, in the mornings that folks maybe that are retired at home, able to ask questions about everything from Medicare to conservatorships, caregiver support, Social Security, and the like. And I like to think this program has done a great job of trying to help answer your questions, applying for TennCare, things like that. We're going to do that again this morning. We're going to open it up, take some of your phone calls after we set the table for you with our guests as to what they can help you with. But this is your chance to call in, 737-7587, to ask questions about any number of things, or you can just sit back and listen and learn, because if it doesn't help you specifically, it might help a loved one or a friend of yours who is dealing with one of these issues. So join in the conversation this morning. We've got two great guests with us this morning from the Greater Nashville Regional Council, and I'll let them explain exactly what that's all about. Michelle Lacewell's Deputy Director. Good morning to you, Michelle. Good morning. Thank you for coming on. We also have with us Sara, Fowler, Director of Aging and Disability Services. Good morning. Appreciate it. Boy, the baby boomers are aging, so this is real important. More and more people seeking out these types of services, right?
That's absolutely true.
Yeah, I mean, we're all getting older anyway. So just to kind of set the table for our viewers so they know if they want to call in one way or the other, I have a lot of questions and ground that we'll cover, but talk about what the council focuses on, how you help people, what kind of issues.
Sure. So I'll back out to kind of a 30,000-foot view. Okay. The Greater Nashville Regional Council is Middle Tennessee's Council of Governments, that we represent 13 counties and 52 cities in Middle Tennessee. Okay. And our role is we are tasked with facilitating coordination amongst those jurisdictions on how we spend our very limited federal and state grant dollars. And I'm sure everyone knows how limited our resources are. And so it's our role to bring those stakeholders together and make sure that we're doing the most we can to support our growing communities and our older adult populations through the resources we receive.
Okay, and I see, just for folks that know, and if you're outside one of these counties, you can still ask a question along those lines.
Absolutely.
But Houston, Humphreys, Montgomery, Robertson, Rutherford, Stewart, Sumner, Trousdale, Williamson, and Wilson counties, correct?
Correct. Yes.
And then also Cheatham, Davidson, and Dixon, I guess, as well.
Also. Yeah. And to your point, we are one of 9 development districts in the state of Tennessee. So there are organizations like us all around the state. So if someone was to hear something they're interested in this morning and want to call our number because it's available, we can put them in touch with the right council.
Good. We'll get the number out as well. But this is something that's created by the Tennessee General Assembly. I mean, it's not new. It's been around for years, right?
No, it's not new. So development districts, which is what we are as a council of governments, was created in the 60s to help facilitate this really important stakeholder engagement and planning and coordination amongst jurisdictions. Because as you know, when you drive from work to home, you may not care if you're crossing a county line. You still want your roads to be good. Exactly. We still need jobs. We still need housing. We still need adult support services. And so our challenges don't stop at the county line.
Now, is this mostly dealing services for the aging population? Is that what it is? Or can it be beyond that?
So there's two things, and then I'll let Sara take that question on for you. So one of our roles is as an economic development district. So we support the economic development efforts in Middle Tennessee. And then we're also the region's regional transportation planning agency. So we work in the transportation planning space and community planning space as well. But most importantly for today is the aging and disability services. And I'll let Sara describe some of those programs.
Yeah, go ahead, Sara.
So GNRC, or Greater Nashville Regional Council, is also the designated area agency on aging and disability. So we get funding from federal and state to provide services and supports for older adults in our region and their caregivers.
Okay, so a lot of stuff going on at this point. We're about to get into the Medicare window right now.
We are. Yes, open enrollment starts next month.
I mean, we've talked about that before. Remind folks, and I'm sure there's viewers right now, the open enrollment, they have their plans, but maybe there's a better one out there. I mean, how do you help people with that? Talk a little bit about what the open enrollment is about, and how long is that window?
That opens
October 15th.
15th, yeah. I couldn't remember.
15th, okay, through
December 7th.
December 7th, good, okay. And this is a chance for them to get into a portal and search. Now, can they call you for help in exploring what other options they have?
Yes, so we have Medicare counselors that
There's a number on the screen, by the way.
That provide unbiased advice.
Right.
So you'll hear a lot of commercials right now with different insurance companies, and they're going to tell you all the benefits of their plan, which, a lot of plans have great benefits. However, what we're going to do is we're going to put that person's personalized information into the system and pull out the best plans for them. So it doesn't matter what company, we're just looking at all of the plans and what's going to best meet their needs, their doctors, their medications, and then they choose which plan they want to go with.
Now, these are supplement plans, correct?
Yes, Medicare Part D.
Part D supplements. So I'm just wondering, and we've had people, ask this question. What if they just want to stay on Medicare and not go for a supplement plan? What advice do you give them? Again, you don't take a side, but you can just go on Medicare. You don't have to get a supplement plan, do you? And what would be the advantage one way or the other?
Well, they do have what's called like Medicare Advantage plans, which then it is more specific on what services and providers you can use. So sometimes you need to be a little more careful when you're choosing those to make sure that that's the right choice for you, because it may limit your choices further on down the line as you age and have more health needs. As far as Medicare Part D, that's the prescription coverage. And really, that's meant to help with prescriptions across the board, not it's different than like the Medicare Advantage or the plans that kind of corner you into more specific ways to provide their
the Part D is interesting too. You get into those plans every year. Cost of meds go up pretty much, which kind of comes to something I was talking to them about before the show. And again, everyone looks forward to cost of living increases on Social Security, if it's going to happen or not. You actually checked just beforehand. I think there's been some reporting on this. I don't know if it's been made official yet. Usually an announcement comes for the increase in October and November. What are we hearing?
What we've found is that they're projecting a 9% cost of living increase,
which
would be a really, if that's actually what plays out, that would be a really significant increase.
The problem is a lot of times they'll say that increase is basically counterbalanced by the cost increase of the meds.
Right, or your Medicare premium.
Yeah, so it's kind of a wash. It's better. At least that doesn't mean more money maybe coming out of your pocket one way or the other. But you're not getting that extra money that you can spend on something else.
Well, no, I know that currently the most recent act that was passed did have legislation in it that will, over the next, I think, 5 to 7 years, try to track down some of those, bring down some of those costs for Medicare beneficiaries. But I don't believe it's an immediate. It'll be a phased process.
All right, so we're going to touch bases, I think, a lot on older adults. What are the percentages of the population that are seniors? What do we see in our area?
So because we start our eligibility with the age of 60, I'm going to use the 55 age bracket and up, which I know it's not.
55?
Everyone defines.
No, what?
Okay. Where census information comes to us.
That's cool.
But it's also important, I think, for everyone to determine when they decide that they're an older adult, right? I mean, we all think of ourselves probably as younger.
Look, it's just a number.
Exactly, it's just a number. Yeah. So if we're talking about just a number, those that are 55 and up in Middle Tennessee, that is about a quarter of our population right now. And we're expecting that percentage of our population to increase to nearly 60% in the next 20 years.
Okay, which is where, I don't know, some of that is beyond the baby boomers, but they've been coming into that. So that people are living longer.
People are living longer, and people are living. They're going to continue to live longer, and we are attracting people to our area that are not only here right now and going to continue to age healthily, but that are going to retire here and move to our area. And so our population, that part of our population, will continue to grow and continue to need resources.
Okay. As we talk about Medicare, it's been a long time on this program since we've talked about TennCare. And can you just give me a primer on that, where that stands and how that works for seniors, I suppose, how you go about going after TennCare, or how that's different from some of the other programs now?
Yeah, so TennCare is meant for low-income individuals, and the financial eligibility is pretty narrow to be eligible. However, if somebody needs long-term care services, so support in their home or nursing home care, that eligibility financially opens up a little bit. And so through our agency, we can help people apply for what's called Choices, which is the long-term care program of 10 care. So that pays for services in the home or for nursing home care, whatever that individual needs.
Okay, so, and we talk about nursing home or in-home care. Yeah, it really does come down. I mean, there's a lot of people out there that think Medicare is going to pay for their nursing home. Ain't going to do that unless you're completely destitute, and then you got to be lucky enough to get into a facility that accepts Medicaid. And they don't all accept them. They don't have to if they don't want to.
Right.
Right? So how do you address that with people? First of all, they need to accept the fact if they want the feds to pay for their Medicaid, they have to be broke. You can't stash some away for inheritance. It's over. Your estate is empty. There's nothing left. Then maybe you get a shot at getting into a nursing home.
Yeah.
Yeah, that's the harsh reality. May as well lay it out there. Because people think, oh, yeah, well, when I'm done, I'm going to go, Uncle Sam will pick it. Wrong.
Yeah.
That's not happening.
Yeah, the expectation is that if you have the means to pay for the nursing
Which,
home
by the
care
way, is the way it should be.
yourself.
Yeah, if you can pay for it, you pay for it. You don't stash some away for an inheritance for your kid. You pay for it. I don't want to have to pay for it if you have money.
And that's part of what we do when we save for retirement. Like, in my head, I'm not saving for nursing home care.
Right.
But that might be what I need when I'm older. So I think as we think about saving for our future, we have to be open to whatever care that means, whether I'm living independently and just hiring somebody to come in and to clean, or whether that means nursing home.
Yes. I mean, there's those options. And we can talk about this when we come back from the break, too. Some people may wonder about long-term care insurance. Because as you said, you don't maybe put it away thinking, but you could think that way. And what kind of advice you give when folks discuss that, who it may or may not be good for. So let's take a break. Do you think we have more to talk about?
I'm pretty sure.
I'm pretty sure we do. Listen, and the phone lines are open. Again, if you're sitting back and listening, fine. But if you have a question about some of what we're touching on, give us a call. We'll be right back with more with our guests right after this.